Let's see, I call this meeting of the Oversight Committee to order, and it is approximately 10:02. Will the board secretary take attendance of the Oversight Committee?
Mr. Angelo. Here. Present. Mr. Margot.
Here.
Mr. Montgomery.
Here.
Dr. Patel.
Yes.
Dr. Rice.
Here.
Dr. Cummings is here. We have a quorum.
All right, thank you. Members, the draft minutes from the August 21st Oversight Committee meeting are available in your agenda packet behind tab 1. Are there any corrections to the minutes as circulated? The chair then will entertain a motion to approve the minutes of the August 21st Oversight Committee.
So moved. Second.
Okay, all in favor, vote aye.
Aye.
Any opposed? Well, this isn't that hard to read. I don't know why you had such challenges with it.
No, but it's hard to put any life into it.
Our next agenda item is public comment. Opening our meetings with public comment underscores the board's commitment to transparency and accountability. There is one request, I understand, for that. And Annette, excuse me, I don't know, I can't read the last. Leslie?
Yeah.
Okay.
Okay.
You're up.
I just want to say thank you for all your hours and hours and hours of hard work, and we're celebrating and doing the Texas two-step all around for your commitment to childhood cancers, which is my heartbeat. And so I just want to say thank you, and that's it. So, well done.
Thank you. Well done by the voters of Texas. Let's move to agenda item number 5. The chair recognizes Mr. Roberts to provide the Chief Executive Officer's report.
Thank you, Mr. Margot. Just a couple of items. Behind the tab, you will find the standing spreadsheet, the 2020 grant award funds available. We are at the beginning of awards for this fiscal year, so there are sufficient funds to make today's awards if you choose to do so. And we will have plenty of balance remaining for the rest of the year. The second item I want to do is you folks will remember that at the last meeting when we recognized Mr. Montgomery by giving Mr. Montgomery a gavel commemorating his 2 years of service as presiding officer. However, the new presiding officer made some denigrating comments about the size of the gavel that we were able to provide. So I want to remind the new presiding officer that regardless of the years of experience you have in public service and now as mayor of El Paso, you are on training wheels. We will present you with your new gavel.
We need a picture.
Thank you. Thank you. It's appropriate. I think Montgomery had something to do with this.
At this point, we're still enjoying the results of November the 5th. A lot of work went into that by members of the Oversight Committee, the staff, and scads of advocates and individuals from around the state. And it's been a lot of fun, the celebration. But as I just told somebody a few minutes ago, after this meeting, the backslapping stops, and we need to start moving forward. We've got a lot to do. The citizens of Texas have entrusted us with another 10 years, another $3 billion. I can't say this often enough because I think it's really cool. But CPRIT is now a 20-year, $6 billion fund. I am unaware of any other state initiative that comes close to what CPRIT is. And that is an incredible testament, of course, to the legislature and the citizens of Texas. Behind me are a number of advocates. This is always, always dangerous to do. We all fall into this trap on trying to recognize people, but I'm going to try. Of course, Chairman Zerwas, Chairman Nelson, Senator Watson, who carried the legislation, have to be at the top of the list. But going through this quickly, Tom Luce, Ned Holmes, Pete Gehring, James Huffines, the former UT board chair, did incredible lifting. David Lakey, now with the UT System office, wrote an incredible op-ed in TMA's magazine that I think carried a lot of resonance. Dr. Lakey is fun because he was a member of the original Program Integration Committee. You still, Dr. Hellerstadt wishes you were still there. But Dr. Lakey really stepped forward and communicated with the physicians of Texas. Andy LeMater, who widow of Mickey LeMater, the former president of MD Anderson, came forward. It's been a really nice opportunity to become acquainted with her. On Senator Nelson's staff, Ann Allensworth. On Representative Zerwas's staff, Nelda Hunter, Meredith Armstrong. On Senator Watson's staff, Sandy Guzman. Annette Leslie, who is just up here. Annette is a firecracker who you cannot ignore. And through Annette, we made some connections with legislators that I was particularly concerned about. But thanks to Annette's work, they became extremely strong proponents of HJR 12. She also is the great go-to for the next recognition, Congressman Michael McCall and his wife Linda McCall, who served on the Campaign Advisory Committee. It's through Annette, it's been my great pleasure to get to know Congressman McCall and his wife, and they are amazingly dedicated to the cause of preventing and curing childhood cancers. Texas Monthly did a public service announcement that you all folks saw one form or another, but the document, What is CPRIT? They ran that on their own in last month's issue. Nadine Craddock, the wife of former Speaker Tom Craddock, wrote a series of op-eds that appeared around the state. Tom Kowalski, David Margraves with THBI, Troy Alexander with TMA, Ken Osborne, Ted Yank from the Dan Duncan Center at Baylor College of Medicine, and Brian Jammer with Baylor College. Peter Pisters, Mark Moreno, Wes Herat from MDA, from MD Anderson, Daniel Podolsky at Southwestern, Ruben Mesa at the Mays Cancer Center down in San Antonio, David Arthur with Solarius, Andrew Strong with Pillsbury Law Firm that has worked with a number of our applicants, was very involved in the campaign down in Houston. Dorothy Gibbons with the Rose. And then, of course, we get into the group of the Texas Cancer Partnership, which is, I don't know if you call it a loosely organized group, but it's sort of a group that has come together to support CPRIT and other cancer-related activities. Whether correctly or not, I kind of recognize the American Cancer Society Cancer Action Network as taking the lead in that. And with them, you've got James Gray, Marina Hinch, Charlie Gagan. Jim Arnold has worked with them quite a bit over the course of the years. And those people, and a lot of these people, have been with us for the last year. This isn't something that just didn't pop up at the end of May. I mean, these people are the ones that got HJR 12 passed so that the voters could take a look at it. The Leukemia Lymphoma Society, Sarah Apolito, Randy Kubriel are here representing them. the Susan G. Komen Foundation. I've mentioned THBI, TMA, Livestrong, David Lofi here, who used to be with Livestrong. I think he's doing freelance work now, but has been at almost every one of our meetings going forward. The other organizations that belong to that group regarding cancer, the Texas Pediatric Society, I need my cheaters because I can't read my handwriting, the Texas Society of Clinical Oncology, the Texas Association of Business, KK125, American Lung Association, Methodist Healthcare Ministries, American Childhood Cancer Organization. I know I have probably hurt somebody's feelings or insulted them, but Marina, I mean, let me turn to you. Marina, who might I have missed in this august group?
Oh, you did a pretty good job.
Well, I'm sure I did, and to those I apologize, but I think we want to kind of stop for a couple of minutes. Didn't you have something for me to do, Kristen, or didn't you have something you wanted to say?
I have a motion for a recess.
Second.
All in favor?
Aye.
Okay. Can I have a motion to come out of recess?
Motion to come out of recess.
Second.
All in favor?
Aye.
Aye. Before we get started, I want to recognize Dr. Craig Rosenfeld, who's joined us. And also I want to thank Kristen for her cookies. I understand that's a weekly event at Seaport.
Retention,
So-
employee retention program.
So, yeah. Do you do the butterscotch cookies every week? That's only, those are for me. Those are for me. All right, let's begin. Were there any, I'm assuming there were no questions for Mr. Have you finished? You haven't finished.
I'll just, it was pointed out to me, as I feared, I left out three important organizations and representatives. Ann Tanabe with Bio Houston, Jorge Varela with Bio North, and Ann Stevens with Biomed San Antonio were also instrumental. And I'm sad to say that I found out just yesterday that Ann is retiring. So whoever replaces Ann has big shoes to fill in Bexar County. With that, Mr. Margot, my report is through.
Okay, are there any questions for Mr. Roberts? Okay. The chair recognizes Chris Cutrone to provide the communications report.
Morning, everybody. My name is Chris Cutrone, Senior Communications Specialist for CPRIT. Just briefly, wanted to just give you all a snapshot of all of the positive media coverage that CPRIT has received over the last few months. If you look at page 3.1 on your packets, we had a number of editorial board recommendations from most of the major newspapers as well as a lot of other smaller markets. And as we had talked about earlier, there were a lot of op-eds written by all sorts of supporters of CPRIT, as you'll see in the Houston Chronicle, El Paso Times, of course, and Victoria Advocate, and as well as in the Midland Reporter Telegram, to just name a few. Also, there was a lot of media coverage in general, just in articles that were all throughout the state. CEO Wayne Roberts was also quoted in a number of them. So those are there for you to all take a look at. If you have any more questions on any of that coverage, let me know. Also, the fall was a great time for us to take advantage of the fact that there was a lot of renewed interest in CPRIT. So as you can see, we did a lot of speaking events. CPRIT staff went all over the state talking with groups at large. mainly just letting them know about what CPRIT is and what it does, and all of the accomplishments. I believe, gosh, when did we do about 40 events?
It was mid-60s when you combine them all.
So that was a major effort of ours, and it was a great time for us to take advantage of the fact that CPRIT was on people's minds. In addition, we're just continuing to work on cancer awareness activities. That does drive a lot of our social media production and website production, and I'm available for any other questions.
Are there any questions from Mr. Cutrone? Yes, Mr. Montgomery?
What was the, thank you, what was the, was there, were there negative editorials or opinion pieces?
There was one negative op-ed. Otherwise, the coverage was overwhelmingly positive.
Okay, thank you.
Okay. Thank you, Chris. The chair now recognizes Mr. Burgess to present the Chief Compliance Officer's report and to provide the compliance certification for the proposed awards.
Thank you, Mr. Montgomery. Always a pleasure. You'll find my my report behind tab 4.
Compliance officers are not supposed to have any sense of humor.
What was that?
I would like to direct your attention to page 4-3. In this section, I summarize FY19 compliance activities. As you are aware, we do monitor grantee delinquent reporting on a weekly basis, and we come together as an agency, compliance staff, program, physical staff, operations, and we track our delinquent reporting. In the chart there on page 4-3, it shows the average, monthly average reporting for the last 5 fiscal years. As you may recall as well, our threshold is about 5%, that's 28, and so we are at 11 for FY19. We had a bump in FY18 to 18, but we're back down, and that's about a 2% non-compliance rate for delinquent reporting, so we're very proud of that. The second bullet there, training and education, again, very proud of that. We conducted 26 training webinars and grantee trainings this past fiscal year. We do require all of our grantees to attend a training, as well as new authorized signing officials, new grantees, and so we had over 500 grantee staff attend those trainings as well. Which, exciting, let's turn to page 4.4, and these two charts show our findings for FY19. So we conducted about 349 compliance reviews, 332 were desk reviews, and 17 on-site. That top chart there is a findings analysis for our desk reviews. So for FY19, of the 332 desk reviews, 20% had at least one finding. You can see that was a decrease in FY18. We had 34%, and then in FY17 we had about half of all the desk reviews had at least one finding. So we are definitely on the downward trend, which is very good, very positive. And we do think that is, partially a result of the training that we're conducting. We do communicate frequently with our grantees around delinquent reporting, and just really are trying to be consistent and clear and provide clarity for our grantees. The second chart there, again, similar, it's for our on-site reviews. So of the 17 on-site reviews we conducted in FY19, 41% had at least one finding, which is down from 66% last year and then 93% the year before. So I thought those charts were fun and good information. So any questions on that?
Vince, any pattern to those issues that keep coming up? Is it the same thing over and over, or is it different, or what?
So we've been seeing a lot of timeliness in reporting, and particularly around our match requirement, our match compliance certification. And so there are some time frames that the match is due 30 days after the financial status report on a quarterly basis. And so there's some timeliness issues with that. Another issue we're seeing quite often is with academic research grantees and CPRIT acknowledgement. So we require for any publication that you acknowledge CPRIT, and then if you are a scholar recruit, that you acknowledge that as well. And so that's been a finding that we see quite often.
Interesting. Craig?
Thank you, Vince. How do you decide which locations to do a site audit?
Great question. So on an annual basis, we perform the risk assessment that we presented to you in August, and we do a random sample of a third of our academic research grants get reviewed every year, and then our product development and prevention grants get reviewed every year. They fall into the priority 1s and 2s, and then the priority 3s, it just so happens, would be academic research grants based on our criteria. But we decided 2 or 3 years ago that even though you were a priority 3, that it was just not prudent to never go on site, even if you're an academic institution. So we instituted a rotating schedule. So a third of those grantees every year for academic research get it as well.
Is the site review, is a site review, like, would that be an entire institution or a particular location within that institution that got the grant?
We would monitor specific grants. So, for instance, let's say UT Southwestern, MD Anderson, they have multiple grants. We would choose in advance a sample of the grants, active grants they have, and look at those. But yes, and for prevention and product development, those are usually just one grant. And we go into quite a bit of detail in terms of sampling match expenses and expenses that have been reimbursed for their financial status reports and their policies and procedures. So it's a pretty involved process.
Anything else from anybody? All right, Mr. Burgess will now provide the compliance certification report for the proposed academic research awards at this time.
Thank you again, sir. As part of my compliance certification, I have several conversations throughout the process with CPRIT staff and with General Dynamics Information Technology staff, GDIT, as we call them. That's our third-party grants administrator. Regarding the supporting documentation, I review the third-party, just drew a total blank, the third-party reporting that we hire an outside agency to attend on my behalf as the compliance officer, the observer report, there we go. And we sample and review all the documentation in terms of sign-out sheets, attendance sheets, and all the other support documentation provided by GDIT. I also attended the November 4th PIC meeting as an observer, and I confirmed that process followed our administrative rules and applicable laws. I do note that Dr. Wilson had declared a conflict of interest for one of the grants, RR 190084. And since that conflict falls under Administrative Code 702.13c1, he did not vote on that entire mechanism. However, in his role as Chief Scientific Officer, he did present the awards to the PIC, but there was no discussion on the awards. And I do believe you will be voting on that, a waiver on that shortly. So after careful review of all the supporting documentation, I am satisfied that the application review process that resulted in the academic research awards recommended by the PIC followed applicable laws and agency administrative rules, and I certify these academic research awards for your consideration today.
Are there any questions for Mr. Burgess? Thank you. Members, what do we do? Am I still on? Okay. Members, I will take an agenda item out of order and recognize Mr. Roberts to present the Health and Safety Code Section 102.1062 waiver for Dr. Wilson.
Yes, sir. Thank you, Mr. Margot. This relates to Vince Burgess's report a minute ago. The memo does encapsulate all of the issues behind tab 9, but in summary, I'm requesting that you approve a conflict of interest waiver for fiscal year 20 for Dr. Jim Wilson, pursuant to general law. Dr. Wilson's son is a senior lecturer in the Computer Science Department at UT Dallas. The waiver is necessary for Dr. Wilson to participate in CPRIT's review process as a Program Integration Committee member. I recommend approval because together with the waiver's proposed limitations, adequate protections are in place to mitigate factors other than merit and the established grant criteria affecting the award of grant funds. It is important to note that this waiver is limited to these specific situations and may be revoked or revised at your pleasure. I request your approval.
Any questions for Mr. Roberts? Okay, is there a motion to approve the proposed Health and Safety Code Section 102.1062 waiver?
So moved.
Second.
Okay, I note for the record that Mr. Montgomery did not.
Oh, sorry. Sorry, that was my mistake.
That's your mistake? Okay, Christian's mistake here. All in favor?
No, but saying Montgomery didn't do something is probably
Yeah, well,
accurate.
all in favor, vote aye. Any opposed? Motion carries. The chair now recognizes Dr. Wilson to provide the academic research program update and to introduce the Program Integration Committee's grant award recommendations.
I'd like, if I may, to start with the proposed grant award recommendations, which are begin on page 8 of the supplemental material that you received today. The Scientific Review Council and then the PIC have recommended 10 recruitment applications for your review today. 4 of these are in the established investigator class, 1 rising star, and 5 first-time tenure-track faculty members. It's a very interesting group. I'll point out that 4 of the 10 are physician scientists, and 4 are chemists. 3 of those chemists are in a area of investigation called synthetic biology that I'll briefly comment on as I go through the descriptions. To begin with, the established investigator group includes Theresa Geis, a physician scientist from Indiana University. This award would enable or support her recruitment to MD Anderson. She is a noted scholar in understanding the skeletal complications of cancer, an NIH Outstanding Investigator recipient, and a Komen Scholar. Ulrich Seidel is another physician scientist. This award would enable his or support his recruitment to UT Southwestern from Albert Einstein, where he is a program leader in their hematologic malignancy program and an expert in understanding the biology of pre-malignant disease, pre-malignant leukemia disease. Ling-Chong Yu is a chemist, actual synthetic biologist from Duke University, who's being proposed to be recruited to Rice University. Synthetic biology is an interesting new area of interdisciplinary study that brings together chemists, electrical engineers, mechanical engineers, biologists to solve problems in adopting biologic understanding to clinical situations. Dr. Yu is particularly interesting in that he has developed a ability to provide bacterial factories for proteins and drugs that can be introduced into patients, and he calls these microbial swarm bots. And it's caught attention of the scientific community quite widely. He's funded by the NIH, National Science Foundation, and Department of Defense. The final established investigator is Dr. Carolyn Aho Franklin, who is another synthetic biologist who's being recruited to Rice from Lawrence Berkeley National Labs. She takes a similar multidisciplinary approach to developing unique biologic components that can be used as signals for internal monitoring of perhaps cancer, new cancer antigens, or other types of important biomarkers. I want to comment that you've heard now 2 synthetic biologists that are being recruited to Rice. They've made a concerted effort to build this area of investigation and focus it on cancer. And in these applications that I've just presented, one of the features that's most notable is that they've integrated the activities that are being proposed with other investigators in the Texas medical institutions, MD Anderson, Baylor College of Medicine, UT Houston. And I think this is an exciting trend that we're continually to see developed among the applications for new investigators that cross institutional areas of potential discovery related to cancer. The next is Dr. Chang Lu, another synthetic biologist recruit to Rice University. This is in the category of rising stars. He's currently at the University of California, Irvine, and he uses synthetic biology to create the opportunity to build more specific antibodies to cancer antigens. He's an NIH New Innovator Awardee and American Chemical Society Synthetic Biology Awardee. And then finally, but certainly not least, there are 5 first-time tenure-track faculty members that are being recommended. Eric Wellen, a chemist, expert in natural products that's being recruited to UT Dallas from Caltech. Gloria Echeverria, a expert in breast cancer research, being recruited to Baylor College of Medicine from MD Anderson, where she's completed her postgraduate training. Matteo Ligorio, a physician scientist surgeon expert in early development of pancreatic cancers, being recruited to UT Southwestern from Massachusetts General Hospital and Harvard. Benjamin Drapkin, a physician scientist, being recruited to UT Southwestern from also MGH and Harvard, with an interest in small cell lung cancer, drug resistance. And then Michelle Ward, a biologist being recruited to UTMB from the University of Chicago. She is interested in understanding how the cardiotoxic drugs, particularly those used in pediatric setting, can be mitigated through study on stem cells related to the cardiac muscle development. So with those summaries, those are the 10 recruitment applications recommended by PIC for your consideration.
Are there any questions for Dr. Wilson?
Very impressive list.
Yeah. I remind members that Mr. Burgess has certified compliance of the Academic Research Award process. It is my understanding that no Oversight Committee member reported any conflict of interest. Are there any conflicts of interest that members have not reported? Members, you have a list of the applications and grant amounts recommended by the PIC for the Academic Research Grant Awards. We will approve the PIC's recommendation if 2/3 of the Oversight Committee members present and able to vote do so. Dr. Wilson presented 3 Academic Research Award slates. Rather than taking a separate vote on the different grant mechanisms constituting 10 grant recommendations, I will ask for a vote to approve all the slates. If a member wants to consider one or more award recommendations individually, please make a motion to do so now. I will entertain a motion to approve the PIC's recommendations for the following Academic Research Grant Award mechanisms: recruitment of established investigators, recruitment of rising stars, and recruitment of first-time tenure-track faculty members.
So moved.
Second.
Okay. All in favor, vote aye.
Aye.
Any opposed? I will entertain a motion delegating contract negotiation authority to the CEO and CPRIT staff and to authorize the CEO to sign the contracts on behalf of CPRIT.
So moved.
Second.
All in favor, vote aye.
Aye.
Any opposed?
So throw it back to him now to do the rest of his presentation.
Okay. You may complete your rest of your presentation.
Thank you. There's one additional action item that we'll bring forward, and in introducing it, I want to briefly give you an overview of the materials that were provided in the meeting book. And these are on or under tab 5. Page 1 under tab 5 presents your current program priorities for the academic research program. These, of course, are what the program uses to identify research RFA opportunities for the Texas academic community. On page 2, Dr. Patty Moore has provided a summary of the activities for the research program over the past year, FY19. I won't go through these in detail, but again, just for your information, the highlights are that of the individual investigator research awards, there's an 11% success rate. That means that 11% of the applications received are deemed appropriate for funding by you. And then you'll note that core facilities support, early translational research, high impact, high risk mechanisms have a higher success rate, and I'll remind you that this reflects the fact that there is a pre-submission vetting by the institutions because these applications are limited, or the mechanisms limit the number of applications per institution. Last year there were 24 CPRIT scholars successfully recruited to Texas institutions. On table 2, again from Dr. Patty Moore, a summary, and there's a lot of data here, and it's again for your consideration as we begin to think about the effectiveness of the different mechanisms in the past. This data is for all 10 years of CPRIT's history of academic awards. It presents by mechanism, publications associated with that mechanism, patents associated with that mechanism, and successful grants that have come as a consequence of the CPRIT instruments. So again, for your review. On page 4 and 5 are the RFAs that are approved for this year, and these have already in the works. The Cycle 1 RFAs will be presented to you in February, and the Cycle 2 RFAs on page 5 will be reviewed this spring and will be presented to you in August for consideration. And then to the action item are the proposed RFAs for fiscal year 21, first cycle. And among these, these have all been vetted with our research program subcommittee and are bringing forward to you for your consideration. There are 5 individual investigator research awards, one that's in an untargeted category, one for childhood and adolescent cancer focus, one for computational biology focus, a award for focus on clinical translation of discovery into actual patient trial, and one for prevention with a focus or intended emphasis on implementation research. And in addition to the individual investigator research award RFAs, we are proposing to recompete the research training awards, which are currently held by 7 institutions throughout the Texas academic community. These research training awards have supported a pipeline of cancer investigators at pre- and post-graduate postgraduate levels, including physicians as well as biologists and prevention epidemiology experts. And in addition, summer internships for undergraduates to bring them into the research milieu early in their careers. So I'll stop there and ask your consideration for this as a action item.
Dr. Wilson has presented the proposed timeline and academic research program RFAs CPRIT will release for the first cycle of 2021. I'm assuming you have a question, Dr. Rice?
I have a question. I apologize. I may have misunderstood, and so I apologize if I've missed it, but I was thinking we had a conversation and we were going to add computational back to 20, or is that not right? I see it in 21.
Well, 20 has already been reviewed and submitted and reviewed. So
okay, right.
And I understand the issue is it's sort of hard for us to imagine that we're already talking about.
We're already in the middle of 20. Yeah.
But
I
in
forgot.
fact, are we okay?
Yeah. Thank you. I'm sorry.
Craig?
For the recruitment awards, is that based solely on merit, or is there any consideration to geography or institution?
The Scientific Review Council considers merit, but also impact. And so within impact, many considerations are involved. One is cancer relevance. One is the institutional commitment in the year, which can address things like geography or other issues. But I think the answer to your question is that the review is instructed to be based on merit and cancer impact.
Thank you.
Anything else?
I have a request. It's not directly related to the action item, but the charts that you gave us that Dr. Moore presented, thank you very much, on pages 2 and 3. Those things I think are terrific. And since we are going to discuss the program priorities in the future, I wonder if we could get this same information for all the 3 areas in preparation, when we come up to the program priorities review.
Certainly.
If we could get, what we've done in the last 10 years broken down according to various categories, I think it would be really helpful to see what we've done in preparation for what we are planning to do. So that's a bit of a sidelight from the...
Yes, but welcomed. Yeah.
These are terrific, by the way. They're great. That's it. Thank you.
I will entertain a motion approving the proposed timeline and academic research program RFAs for the first cycle of FY 2021.
So moved. Second.
All in favor, vote aye. Any opposed? Motion carries. Members, you have a memo in your agenda packet regarding a request from the University of Texas Southwestern Medical Center to make a budget change for Core Facilities Award RP 180770. Are there any questions for Dr. Wilson or Mr. Roberts regarding the request or CPRIT staff's recommendation to approve the request? Okay, I will entertain a motion approving the budget change request for RP 180770.
So moved.
Second.
All in favor, vote aye.
Aye.
Any opposed? Motion carries. The chair now recognizes Ms. Majid to provide the Chief Prevention Officer's report.
Good morning, everyone. Have a brief report for you this time as there are no awards. Under tab 6 on -1, prevention program received 28 applications, and those will be going under review December 10th and 11th, and the PIC recommendations will be presented to you in February of 2020. The FY 2020 Cycle 2 RFAs were released in November, on November 11th, and those will be presented, the PIC recommendations will be presented to you next August. The 3 RFAs that were released are familiar ones to you. We did not make any changes in the second cycle. Those are listed on page 2 under tab 6. And lastly, the program priorities, the subcommittee recommends to the Oversight Committee approval of the prevention program priorities that Mr. Roberts will discuss in a few minutes. They are listed on tab 10, page 11. They are the same as they have been for the last year. So with that, it's the end of my report, and I'll entertain any questions.
Are there any questions for Ramona? Anybody? Thank you.
Thank you.
The chair now recognizes Dr. Walker Peach to present the product development research update.
Hello, everyone. I'm happy to provide this update on the product development program. I'll draw your attention to tab 7 in your meeting packet. I'll begin with an update on fiscal year 2020 Cycle 1. As you may remember, this was approved by the OC in February of 2019, the release of the Texco, RELCO, and SEED award grant mechanisms. We opened Cycle 1 in June of this year and closed it in August of this year. It yielded 42 applicants. 2 of those were administratively withdrawn, which means that the applicant did not meet the criteria outlined in the RFA. 40 applicants then were screened telephonically in September of this year. Of those 40, 17 of the applications were invited to present in the in-person presentations in Dallas. Of that 17, 1 of the applicants withdrew before the presentation occurred. So 16 applicants presented in Dallas in October, and 7 of those applicants now are currently in ongoing due diligence. So those are the applicants that make it through diligence and recommended by the PDRC, and the PIC will be presented for your approval in February 2020. Okay, so those 7 applicants now are in diligence, and I'm going to spend a little bit of time focused on some process improvements that we have brought to the diligence program. To the diligence piece of our peer review program, and these are being piloted during the 2020 Cycle 1, the ongoing diligence that we're having right now. So please recall that CPRIT has contracted with 2 types of diligence partners. The first are various law firms that look at the IP and licenses and other legal matters that are associated with the company and the project being proposed. The second is a group called ICON. ICON does diligence on the applicant's business, the clinical pieces of it, the regulatory pieces, and all of those plans are reviewed by ICON. The enhancements that I'll discuss here in just a moment are focused on the ICON diligence portion. So why have we even entertained or contemplated making some of the enhancements to our current peer review system? And it was because the PDRC wanted to surface very early on and prioritize critical issues associated with each of the applicants. The theory is that if you have robust, well-formed questions, the results from that will be thoughtful responses from the applicant. And the PDRC wanted to enhance that diligence piece, and that's why we are contemplating these enhancements. So what are they? What have we done during this pilot portion of the diligence? The chairs of the PDRC have been enlisted to place more emphasis during the initial screening call on discussion and prioritizing the peer review questions that will be presented to the applicants so that they can respond during the in-person presentations in Dallas. CPRIT's logistic partner, that's GDIT, you heard Vince talking about that a moment ago, has added an additional 10 minutes after each applicant's presentation to allow the chairs to facilitate and prioritize all the key questions that the peer review team has for this particular applicant. The third enhancement is the PDRC chair and the deputy chair have assigned PDRC members to each of the applications so that PDRC member can participate with ICON on the diligence call with the applicant. And lastly, ICON has reformatted its diligent report to include both the peer reviewer's key questions, the applicant's responses, as well as ICON's independent review of the applicant's plans and project. So overall, these enhancements will support the PDRC's focus on critical issues associated with each of the applications and should bolster the informed funding recommendation that comes from the PDRC. maybe I should pause there and see if there are any questions on this piece.
Any questions?
Yes.
Mr. Montgomery?
I presume it goes without saying none of these enhancements will compromise the integrity of the process.
That is correct. So these
Thank you.
that's correct. And you'll find a piece on that on page 7-2. These process improvements will neither impact the applicant nor materially change CPRIT's established peer review process. No administrative rule has changed. Yeah. But I think the one critical piece, though, is that we had to put, CPRIT had to initiate some waivers to allow the PDRC members to participate in these calls. That's correct.
Cindy, is there one person who will be on the call for the product development committee?
There will be one PDRC member per call, per applicant per call, yes. That is correct.
Any other questions?
I'll quickly proceed then. So an update on the Cycle 2. As you may recall, the Texco, Relco, and SEED grant award mechanisms were approved during the August OC meeting. We plan to open the application portal in December of this year. We'll close that at the end of January in 2020. Screening call dates are March of 2020. In-person presentations, again in Dallas, will be in April. The applicants that are recommended by the PDRC and the PIC will be presented for your approval at the August 2020 OC meeting. Moving forward then with the product development program priorities. The product development research program priorities are established based on the following principles. Support commercial product development of novel technologies that address unmet cancer healthcare services and treatment needs. Stimulate the Texas life science ecosystem by supporting product development funding gaps that lack adequate private funding. Invest in projects based on sound scientific and business merit with the potential to attract additional private funding necessary to launch cancer healthcare-related products and services. With the Oversight Committee's approval, the Product Development Program recommends the continuation of the current program priorities for fiscal year 2021 and as detailed in your meeting packet. These are unchanged from fiscal year 2020. And with that, I have concluded my report.
Any other questions? Thank you.
Thank you.
Chair recognizes Mr. Roberts to present his appointment to the Scientific Research and Prevention Program Review Panel.
Thank you, Mr. Margot. I provisionally appointed 4 experts to our Scientific Research and Prevention Programs Committee. Our statute requires that the Oversight Committee approve the appointments. The Nominations Subcommittee discussed the appointments at its meeting on November 15th and recommends that the Oversight Committee vote to approve the appointments.
Is there a motion to approve the Scientific Research and Prevention Program Committee appointments?
So moved.
A motion is second. All in favor vote aye.
Aye.
Any opposed? Motion carries. I will ask Mr. Roberts to present CPRIT staff recommendations for the fiscal year 2021 program priorities.
Thank you. You've just heard from each of the program officers their proposals for the 21. Let me make sure I'm looking at the right sheet. 21 program priorities. We are required by law to approve these on an annual basis. As mentioned, these are what's brought to you today are the same as those that you adopted last year at the November meeting. And these program priorities will govern the remaining amount of the initial $3 billion authorized in 2007. So beginning next year, we get to start working on the second authorization. As staff, we plan to propose for your consideration next year the near and long-term goals to guide CPRIT's activities for the next 10 years. That said, the process for developing this plan is contained behind tab 10 in your meeting books, but generally what I anticipate happening is we will work through our several advisory committees that we have established with public input. We will work through the subcommittees of the Oversight Committee as this process begins, which I anticipate to be very late winter, early March. There's not an immediate pressure to do this. There is sufficient time for us to do it in a deliberate, considered manner. But I want to emphasize that there will be oversight committee involvement, there will be public input into the process, and it will be transparent. With that, Mr. Chairman, I recommend the committee's approval of the 21 program priorities.
Are there any questions for Mr. Roberts or the program officers? Chair will entertain a motion to approve the fiscal year 2021 program priorities.
So moved. Second.
All in favor, vote aye.
Aye.
Any opposed? Motion carries. The chair recognizes Mr. Graves to present a status update on internal audit activities.
Good morning. Yes, I'm Dan Graves with Weaver, one of the internal auditors for the agency, and we'll be presenting the status of the remainder of the 2019 plan, the schedule for the 2020 plan, and then also our annual internal audit report for your approval. On page 11-1 is our report. On page 11-2 is the new information for this period. As far as the remaining 2 follow-ups that we had, provided you a status at our last meeting. We have closed those out. The information security follow-up audit, or the follow-up procedures were canceled. The remediation efforts from the agency continue to progress. We received a status from the agency on those. We just did not perform any procedures in order to allow the IT department to continue to focus on the rollout of the new agency website. As far as the communications follow-up, that is on page 11-6 of your materials. And we performed our follow-up procedures and finalized our report in October. 2 of the 5 outstanding findings were completely remediated, and the remaining 3 had progress made and will continue to have further progress made, as they are also tied to the rollout of the website as well. On page 11-3 of our report is the 2020 internal audit plan and schedule. This is the plan that you approved at our last meeting, but we also wanted now to provide you the dates of the planned procedures and the different audits and follow-ups that will occur. And so that is on page 11-3. And on page 11-5 is actually the summary of all the activity and remaining internal audit findings. And so this is a good summary that we've presented for a while now. Call your attention to the last row on the bottom of the page and just show you that at the start of the year we had 18 internal audit findings that were open, and it says 22 of those are new for this year from the state reporting internal audit that was completed in January. 15 of those were remediated this year, and so that's amazing progress on the annual summary for the agency. There have the 3 remaining open and 2 new ones to have 5 total at the end of the year. So wanted to commend the agency on the progress made on open findings and closing those out, their attention to those, and provide that to you as well. The last item I have is on page 11-19, which is our annual internal audit report. This is an annual requirement by the State Auditor's Office and the Texas Internal Audit Act. It's a summary of all the 2011 activities, as well as a few other required reporting elements, such as the quality review report of your internal auditor, so our firm's quality review statement. It also includes the 2020 plan and a few required disclosures, such as fraud, waste, and abuse, and compliance with state statutes for posting the report and plan. And that I present to you. We presented these to the audit committee and present the annual report for your approval so that we can then publish that out to all the state oversight agencies and the SAO. Any questions?
Any questions for Mr. Graves? Is there a motion to approve the follow-up procedures report over communications?
So moved.
All in favor vote aye.
Aye.
Any opposed? Motion carries. Is there a motion to approve the FY 2019 Internal Audit Annual Report?
So moved.
Second.
All in favor vote aye.
Aye.
Any opposed? Motion carries. The chair now recognizes Ms. Eckel to discuss the final order approving amendments to Chapter 703.
Thank you, Mr. Chairman. The rules are located behind tab 12 of your meeting book, and we only have a final order for you at this meeting, no new proposed rules. The final order has the rules that were presented at the August Oversight Committee meeting. They were published in the Texas Register, and we did not receive any public comments, so they are presented for adoption just as they appeared in August. And we'll send these over to the Secretary of State to become final in early December. And that is it.
Any questions from Ms. Eckel? Members, is there a motion to approve the final order adopting rule changes to Texas Administrative Code Chapter 703?
So moved.
Second.
All in favor vote aye.
Aye.
Any opposed? Motion carries. The chair now recognizes Ms. McConnell to present the Chief Operating Officer's report.
Good morning, members. I'd just like to highlight some items in my report since you've had an opportunity to review it. We did receive about almost $50,000 our fourth quarter of FY 2019 in revenue sharing payments, so that brought our total revenue sharing payments to a little over $3.7 million. So we're still hovering right around there, and that's since inception of CPRIT. We also completed our annual performance measure report to the Legislative Budget Board. We met or exceeded performance in 4 out of our 5 measures. The one that we did not meet performance in was the relocation of product development companies because we did not have any companies that relocated during FY 2019. With regard to our debt issuance history, we did complete our issuance of total debt of $202.7 million in FY19. And I know this has been a question that's come up. So our commercial paper rates have been fluctuating at 2 to 2.5% over the year. And in terms of long-term debt, we haven't had a pricing for our particular bond since September of 2019 when our debt was rolled into long-term. But that true, all-in true interest rate, which is a combined measure of all interest rates over the course of all of the debt issuances for us specifically, is 3.66%. So it's still very good. And just so you know, for 2020 and 2021, when TPFA did their estimates for the state budget, they estimated 5.5%. They kind of have a safety factor. And then actually beyond that is 7%. So there are some projections that I believe show long-term interest will start going up, but that's just a, projection. In terms of the 2020 conference, we are still moving forward on that. Our website will launch at the end of November, and our conference registration and abstract system registration will launch at the end of January, beginning of February of 2020. So we're moving ahead on that. Are there any questions about my report?
Any questions?
Just when is the conference?
July 30th and 31st of 2020, downtown Austin, the convention center, and the hotel will be the Fairmont, which is connected.
We chose it for the climate.
Yeah, I figured that, yeah.
And I might remind Mr. Margot that keep your calendar clear for that because you get to help open it.
I need to get.
I'm available if he's busy.
He can't give it up, can he? He just can't give it up.
I don't want to add to your pressures, but
so give me that date again.
July 30th and 31st.
And July 30th is the big one for you.
Okay. All right. Moving on to the next agenda item, Ms. McConnell, will you explain the recommended contract amendments to the outside counsel contracts?
Yes. So in August, the Oversight Committee approved 3 contracts with 3 different legal firms, Baker Botts, Udell Isidore, and Vincent & Elkins, for $125,000 each. Since then, our legal counsel has been advised that Vincent & Elkins no longer has the personnel to perform IP intellectual property due diligence. So they propose that we take the money that was going to be in the Vincent & Elkins contract, which has not been executed, and divide it evenly. So $125,000 divided evenly is $62,500, and apply it to the other 2 remaining contracts with Baker Botts and Udell Isidore, and that would bring each of those contracts to $187,500, and then so that CPRIT staff can still manage the conflicts that may exist between the legal firms and company applicants in the performance of the IP due diligence. We also ask that you allow legal counsel to potentially balance some of the contract amount in the event that one of the contracts actually needs to exceed the $187,500 because of the conflicts. That's why we originally had 3 firms. And then they will just notify you of if that happens.
Any questions for Ms. McConnell? Members, is there a motion to approve the amendments for fiscal year 2020 outside counsel services contract with Baker Botts and Udell Isidore?
So moved.
Second.
All in favor, vote aye.
Aye.
Any opposed? Motion carries.
Thank you.
All right. Members, I will take up agenda items 15 and 21 together. CPRIT's legal staff prepared a legislative update on notable changes to the Texas Open Meeting Act and the Texas Public Information Act. It's behind tab 13 in your agenda packet. Review of this memo fulfills CPRIT's required training. We will move into closed session pursuant to the Texas Open Meetings Act, section 551.071, to seek advice from counsel. The Oversight Committee members will move to the anteroom at this time to convene in closed session. The following CPRIT staff shall join the Oversight Committee in the closed session: Mr. Roberts, Ms. Doyle, and Ms. Eckel. For everyone in the audience, the only item that we will take up once we conclude our closed session is the adjournment of the meeting, and our time is now 11:25. We have a motion to come out of executive session. So moved. All right, we have a motion and a second to come out of executive session. All in favor? Aye. Motion to adjourn.
Motion and second.
There's a motion to adjourn and a second. All in favor? Aye. We're out of here.